Access to dental care is an issue in a lot of states, particularly states with rural areas, and anything that we can do to get out of the way of that care being provided to people is an important thing, and hiring a mid-level provider is just a natural fit. If you think of healthcare as a market where there are people providing a service and there are people who are in need of that service and we want to bring them together, one of the things you want to do is to allow people to access the appropriate level of care in as safe a manner as possible. And generally, scope of practice regulations are designed to prevent people from entering the market, to limit the supply of care. And that's great for the people who are currently providing care because they can't be competed against. But it's horrible for the people who want care. I think it's important to have dental therapists, frankly in every state, because we've reached a stage where where we want more options, and people are increasingly more and more responsible for their own health care. They need to have more options for their own health care, and they don't need to be locked into a system that existed in 1952 and should never change. With a dental office as a small business, if you add providers at multiple levels, you have a dental therapist, you have a hygienist, you have a dentist. One of the things that you allow to happen is that everybody is providing the most appropriate level of care, and it allows for that office to provide a much fuller range of services, and a range of services where each task is being performed by the person most appropriate to that task, which is great for the office and is great, frankly, for the customer. One way to think of dental therapists as an issue is the way we think of the rest of healthcare as an issue. It used to be that you had a doctor and a nurse, and that's all you had. And those were your only choices. But increasingly in society today, the last time I went to the doctor, I saw a nurse practitioner. I see a nurse practitioner a lot. There are a lot of things that the doctor doesn't need to do, the nurse practitioner can do, or the physician's assistant can do. And what we see in medical care is that dramatically increases the level of service, that dramatically increases the likelihood that you can be served quickly. This is extending that philosophy to the dental field, so that dental care is approached exactly the same way. And it's amazing that it's not being done in every state in the country. Dental therapists allow greater dental care at no cost to the state, with no safety issues to the government. There's no reason at all not to do this. All you're doing is increasing the supply of dental care to people who need that dental care, and at no cost to the government. This is one of the few times government can take an action that helps everyone involved at actually no cost to the taxpayer.